contrast medium is interesting because a lot of people don't have the IV contrast medium that you end up using. And so what you end up finding is if you have a bottle of iohexol or Conray or Hypake, a lot of people end up worrying about what type of contrast medium they use. But as long as the dog is actually normotensive, you don't have any sort of dehydration issues, or you put them on IV fluids, it's actually fairly safe. And the nice part is there's not really any other way to functionally see whether the kidneys are working or not. Because when you give contrast medium, it gets excreted through the kidneys, and if the kidneys aren't working, then you're not going to get the contrast medium to excrete out. And also if they're in renal failure, like an anuric renal failure, the contrast medium will just accumulate inside the kidneys and it won't actually excrete throughout the ureter. So it gives you some nice functional information, but it's kind of all or nothing. It's either going to work or it doesn't work. So we can't figure out glomerular filtration rates or things of that nature. But if you have a ruptured ureter, if you have a ureteral lift, if you have an ectopic ureter, it's a great easy way that anybody can do it. Whereas ultrasound is a lot more user dependent, takes a lot more skill and a lot more training to be able to track a ureter. But if you just give IV contrast medium and take some radiographs at 5 and 10 minutes, you'll see the ureters and you'll see whether they go into the urinary bladder or whether they go out into the urethra, and then you have your diagnosis. So it's a very useful tool, especially for a quick, easy assessment of a dog that hit by a car or anything of that nature that you're really worried about the urinary system. You want to know if there's a ruptured urinary bladder, things of that nature. Quick, easy, and so you can use it in everyday practice.